In this video, I'll be discussing my journey with endometriosis. I'll also be touching briefly on endometrial polyps, cervical ectropium, and a split uterus. I'll be sharing some tips and some advice on how I myself have helped heal my own symptoms and helped aid the healing process of endometriosis. Hey guys, welcome back. My name is Tia and the purpose of this channel is to inspire, motivate and coach you into a healthier lifestyle. And guys, before we start, I just want to throw this out there. I am not affiliated to any marketing companies and neither am I medically qualified. I am just purely and simply sharing my journey with you. Today I thought I would touch on a topic that I myself and many women that I know have had to go through, which is a condition called endometriosis. And before I even go into this video, I just want to give a huge shout out to a beautiful lady called Ellie Brown. She's not only an inspirational woman, but she's also a fellow sister of Christ of mine. And what can I say about her? I don't want to say too much because I really want you to go and check her out. So I'm going to put her information in the description box below. But the purpose of her channel is for survivors to thrive. And I remember back last year when I was in hospital and I was going through a really challenging time, I came across her videos and they gave me so much encouragement, and not just in my situation, but to also share my journey with you. So thank you, Ellie. Why am I sharing my journey? Well, I feel that I wasn't educated enough before I delved into my journey with endometriosis, and I truly believe that we grow through what we go through. I know that every trial I've faced in life is purely an opportunity to share and encourage others through my own experience. And I think it's super important that whatever surgery we're going to have, whatever procedure we're going through, whatever sickness we're having, that we really need to understand our bodies. And I think that's extremely crucial. We can have surgeries to put things right, but at the end of the day, it's still our bodies that has to go through the healing process once it's given the right tools and conditions to do so. And I believe when you understand how your body works, you automatically will find the knowledge on how to treat it. Simple, because we should know the houses that we are living in, right? So that's why I think it's important that I just shed a little bit of light on endometriosis and also just educate you slightly on the things that I had no idea about beforehand and give you some brief anatomy on the female reproductive system, but also how to help heal endometriosis naturally. Honestly, it has affected my life in quite a few ways. First of all, for example, I have had to put my personal training career on pause simply because it affected my physical activity in a lot of ways. It also allowed my body, well, not allowed my body, it made my body become extremely run down at times, which was difficult to manage. And a topic that's probably the most personal to me, it has also affected my fertility. Looking back, it just seems like so many. But I think just to list a few, I used to get quite regular headaches. I used to feel nauseous, so feeling quite sick all the time, which I still get that occasionally. I used to get a lot of cramps and pains in my lower abdominals. I used to get lower back pain. I used to have irregular bleeding in between periods, bleeding during intercourse. Yeah, that's just to name a few. But to be honest with you, right from the beginning, there was a lot of confusion as to where all my symptoms were coming from. And unfortunately, not a lot of answers, just a whole heap of tests. In the beginning, there was a lot of smears. I was probably having a smear every 3 to 6 months due to my first smear coming back with abnormalities, and every smear after that either coming back with abnormalities or borderline. I never had a normal smear test. But at the time I was told that they weren't going to be looked into further due to my age, but also the possibility of them being able to go away by themselves. However, fast forward a few years, I was still getting a lot of symptoms, constantly feeling sick all of the time, and a lot of pain in my stomach and lower back. So that's when I was referred for a endoscopy and a colonoscopy. Now, these two procedures sound like, what are these words? I had no idea what they were. So I have done a little bit of research for you and put some information together that I'm going to discuss briefly now. However, if you look in the description box, I am going to be putting a free information pack that I've created for you. So just please make sure you check that out after this video and share it on if anyone that you know may have endometriosis. So what is an endoscopy? If you're anything like me, I had no idea what this procedure was, and it sounded a little bit more scarier than it was. It's simply a procedure where they place an instrument called an endoscope, which goes through your mouth, down your throat, into your stomach. This procedure can be used to look at several organs in your body, but in my case it was to look at the stomach. During the procedure, they basically sprayed a little bit of local anesthetic into the back of my throat and gave me some sedation just to relax my muscles at the time. And what can they do through an endoscopy? They can go in and they can take small biopsies, which is taking small parts of tissue inside just to investigate further, which they did for me. And they can also just check to see if there's any abnormalities. In my situation, my endoscopy did come back with some results through my biopsy, which told me that I contracted a parasite when I must have been abroad. So I thought that was the end of my sickness, because they told me that would have been the cause to my sickness, and they gave me some antibiotics to treat it. However, the antibiotics didn't work and I continued to feel sick. Then there was the colonoscopy, which is basically pretty much the same as the endoscopy. However, instead of it going down your mouth, it goes up your bottom into your bowels, and it does the same procedure, where a thin tube is installed, like a telescope, with a light and a camera at the end, which is a flexible one when it has to be, where it can go around through your bowels and do the same thing. In my case, they took more biopsies, so took more small tissue samples, just to investigate a little bit further, which fortunately they came back okay, but they did discover that my bowels were inflamed. But again, due to my sickness continuing and the inflammation in my bowels, I was referred for more tests. So due to the results from my endoscopy and my colonoscopy, I was referred to an amazing gynecologist that really took the time to listen, to look at my notes, and really spend some time explaining the results to me. And praise God, because that was the beginning of my journey of finding answers, and this was in 2018. After my consultation with my gynecologist, I was referred for two simple procedures, which was an ultrasound. I had to have an external ultrasound and an internal ultrasound, which that did come back with, to my surprise, that I have a split uterus. So I was never told that before. It does explain when I was having my son that I had to have regular checkups. I was getting scans every 2 to 3 weeks, which now I know why. A split uterus is, if you just look above my head, and again there will be the same information in my information pack. It's basically where your normal uterus has like a dome shape at the top. However, with a split uterus, due to the fallopian tubes not connecting properly, it has like a indent in the middle, which basically looks like a heart. Now, the other procedure that I had was a colposcopy. With a colposcopy, it's very simple. You have an internal examination where they insert a speculum and just can go in with a small tube with a light, where the gynecologist can look further into your cervix and check if there's any abnormalities. Now, in my case, there were, which she was able to see some endometrial polyps, was able to see that I had cervical ectropium, or in other words, cervical erosion. And again, she could see the abnormal cells. And what is a hysteroscopy? So basically a hysteroscopy is where the doctor will use a small telescope with a camera and a light on the end. that will be entered through your womb and passed through your cervix for the doctor to be able to see better inside your womb. And during the procedure, they will put a fluid, an antiseptic fluid, to clean your cervix, and they will then remove any potential fibroids or endometrial polyps, and they can also remove abnormal cell tissue at the same time. And then there's cervical ectropium, in other words, cervical erosion, which, don't worry, that does not mean that your cells are eroding away, which I thought that was the case. But basically, this is where the cells from inside of your cervix start to grow on the outside. And this can cause a lot of inflammation, redness, and soreness. There are 2 treatments that can be done for this, and I had both of them done, and both under local anaesthetic as well. There's no need to be put to sleep for this one. And that is cervical cauterization. And this is where an electric current is used to simply burn off the top layer of the cells. And the other treatment is called silver nitrate, and that's where a fluid called silver nitrate is simply applied on top of the cells. However, after both of these procedures, which are very simple procedures, I had complications and ended up back in hospital. But if I'm completely honest with you, I feel it's simply down to the fact that I wasn't educated enough on how to deal with the aftercare or how to treat my body after years of procedures, tests, and antibiotics. So I honestly feel it's simply because my body couldn't cope with the process. And that is when I began my journey on discovering on how I can heal my body from this condition and help aid it to a healthier state of recovery. And I have gone through my journey without being educated in this area. So please guys, before the doctor just refers you for any of these procedures that I have mentioned, please be sure to watch this video right to the end, or continue to do some more research of your own, because it's super important that you have an understanding of what these procedures are about, but also to have some natural remedies that you can try first that will help. Might take a little bit longer, but they will help aid your recovery and the condition that you have. Because remember guys, knowledge is the key to all understanding. Endometriosis is a condition that affects the female reproductive system. Now, studies have shown, which completely blew my mind, that 1.5 million in UK has endometriosis, and 200 million women worldwide have it. So 1 out of 10 women will have this condition. So chances are either you have it or somebody that you know has it. So I just really want to stress this to you and let you know, which encouraged me to, you are not alone. Because endometriosis manifests itself in many ways, it can be extremely difficult to diagnose. And studies have also shown that it can take up to 7.5 years from the first doctor's appointment to diagnosis. Like, how crazy is that? Now, I'm quite embarrassed to say that I didn't actually really know what was going on inside of my reproductive system. So I am just going to give you a bit of a visual to give you a better understanding. Now, to some of you, you might be thinking, what is going on? But I'm sure there's going to be quite a lot of people that's going to appreciate this, because I know I did. Endometriosis is where the tissue that lines the inside of the uterus, called the endometrium, grows outside of the uterus. Endometrium is the innermost layer of the womb. Now, endo means inner, and metrium means womb. Makes sense, right? So it most commonly grows in the tissue lining of the pelvis, the ovaries, and the fallopian tubes. In severe cases, it can spread behind the reproductive system. Every month, the woman's body has a menstrual cycle and a hormonal change that signals the lining of the uterus to thicken. And this lining is called the endometrium, which then responds and builds a layer to prepare the body for fertilization. But for women with endometriosis, this tissue grows outside of the uterus and other areas, which thickens and sheds with every period. However, unlike a period, this blood has no way to leave your body, causing lesions, which results to more painful and heavy periods, and is also one of the leading causes of infertility if left untreated. There are several studies on what causes endometriosis, but today I just want to highlight 3 of those to you today. The first one is immune dysfunction. Now, if your immune system is low or run down, it will make it even harder for your body to fight off any of these growths or any abnormalities that's in your body. So it's super important that we build our immune systems up. The second one is environmental causes. Now, toxins have a huge damaging effect on our bodies, especially our immune system and our reproductive system. So even though it's extremely important to be cautious of what we are putting inside our body, we have to be just as cautious on what we are putting on our bodies. So on our skin and what we are breathing in, such as like perfumes, air fresheners, all of these things can have a damaging effect on our hormonal imbalances as well. Now, the third one is hormonal imbalance. Hormones are chemical messengers that send signals to your organs. So therefore, if there is a hormonal imbalance, then that means that your organs are not getting the correct signals to function properly. Now, it is so important to know all of the symptoms because 50% of women live with this condition unknowingly. So I'm going to list a few, so take a look. The symptoms that can affect the uterus are heavy periods, heavy clotting, longer menstruals, ovulation pain, irregular periods, painful periods, and pain starting before your period. It can also cause symptoms that can affect your bowels, which can include painful bowel movements, pain when passing urine, blood in your stools, and symptoms of irritable bowel, which can be diarrhea or constipation. There are other symptoms involved, such as feeling nauseous, extreme tiredness, depression, frequent infections, feeling faint during periods, lower back pain, painful intercourse, and of course, infertility. Thankfully, the answer is yes. Just to name a few, there's treatments such as hormone treatment, natural pain management, through good nutrition, through some other complementary therapies such as acupuncture and cupping. But one of the most important things I think that women should definitely look into whilst going through endometriosis is to get yourself a really good emotional support system. Because it's not just a painful period, it's much more than that. And now you know through this video you're not alone, so please do get yourself a really good support system around you. Now, finding relief with your symptoms is really important when you're trying to manage this condition. And thankfully, there are loads of natural remedies out there to help you reduce symptoms, help you with pain management, and also with the healing process. Now guys, I cannot stress how important it is to detoxify your body and balance your hormones. And I'm going to take you through 6 steps on how you can do this. And step 1 is cleanse your liver. Now, your liver is the core organ that's in charge of your estrogen management, which is vital to your reproductive system. So we really, really must learn to love our liver and learn how to take care of it. And how do we do this? Through diet and natural herbs. Dandelion tea, milk thistle, lemon water, and supplements. Step 2 is probiotics. Guys, it's so important to help repair your gut because this will help you boost your immune system and balance your hormones. Step 3, your diet. Implementing anti-inflammatory foods is so important to help manage your endometriosis. Here are a list of foods to avoid and to implement into your diet. Foods to avoid: meat, dairy, gluten, unhealthy fats, and coffee. Foods to increase: leafy green vegetables, beetroot, broccoli, turmeric, and pineapple. Berries, all kinds of berries, chia seeds, flax seeds, coconut oil, pumpkin and sunflower seeds, avocados, and almonds. Step 4, essential oils: clary sage, lavender, peppermint oil, and castor oil. Step 5, supplements: ashwagandha, adrenal glands cleanse, omega-3, B complex, and progesterone creams. Step 6. Complementary treatments. Acupuncture, cupping, and massage. And alongside these 6 steps, it's important to implement some general lifestyle changes, such as getting a good night's rest, drinking plenty of water, and getting in your daily exercise. But remember, you must know your body to know what is right for you. So please only implement the tips that you know your body can handle. Please let me know in the comments section below how this video has helped you in any way, and I'd love to hear some recovery stories from you guys. And if you'd like to see more videos from me, then be sure to like, share, and subscribe. But until then, stay safe, stay healthy, and stay blessed. And thank you so much for watching.
Why am I stressing? I better count my blessings. Life could be more threatening, but it is.